The first thing to consider in answering the question, how can I relieve foot pain, starts with a location of the pain and any other symptoms that may accompany your discomfort. Heel pain. If your pain is in your heel, there's a good chance you may have a condition doctors call plantar fasciitis. That's an irritation or inflammation of the band of tough tissue connecting the heel bone to the toes. Plantar fasciitis usually hurts worst in the morning as you're getting up. Treatment for heel pain includes the following: resting your foot, doing heel and foot muscle stretches, taking over-the-counter pain relievers. Another source of foot pain is a heel spur. Heel spurs are bone growths that appear on the bottom of your heel. They result from wearing shoes that don't fit or from poor posture when you're walking. Individuals with flat feet or high arches are more likely to develop painful heel spurs. To treat heel spurs, do the following: wear a cutout heel pad. Use a custom-made insert called an orthotic worn in the shoe. Take over-the-counter pain relievers. Rest your foot. If pain persists, ask your doctor about options for a medical procedure. Stone bruises. A stone bruise is a deep bruise of the fat pad of the heel or ball of the foot. These often result from impact injuries or stepping on a hard object. When you have a stone bruise, it feels like you have a pebble in your shoe. Happily, stone bruises usually heal on their own, but while they do, try to rest your foot, apply ice, and take pain relievers. Arch pain. The most common types of pain involving the arches include the following. Plantar fasciitis, besides affecting the heel, is also the most common cause of pain in the arches. If plantar fasciitis doesn't heal on its own in 2 to 3 weeks, an injection combining a steroid and local anesthetic can be helpful. Fallen arches, commonly called flat feet, happen when the arches flatten out due to a number of possible causes. Some people are born with flat feet, but they can also result from stretched or torn tendons, broken bones, and certain conditions like rheumatoid arthritis. Treatment includes wearing shoe inserts, shoe adjustments, braces, rest, ice, and using a walking cane. In some cases, physical therapy or surgery may be needed. Pain on the foot's outer edge. This happens most often when the bone on the outer edge of the foot is fractured. Symptoms include pain, swelling, and bruising along the outer foot. Generalized foot pain. Sometimes pain can seem to affect the entire foot. There are 2 main reasons for this kind of discomfort that seems to be anywhere and everywhere. Neuropathy, or nerve damage in the feet, causes a burning, stinging, tingling feeling. Neuropathy is usually caused by diabetes. When you have this condition, it's best to work with your doctor. Another reason for generalized foot pain is tendinitis, which happens when tendons become inflamed and irritated. Tendons are the tough bands that attach the muscles to the bones. Relief from the pain of tendinitis involves rest and taking pain relievers. Sometimes steroid injections are a good idea, but surgery is rarely necessary. The purpose of this video has been to provide quick, basic answers to the question, how can I relieve foot pain? For additional information, click on links to related resources below the video screen. But remember, you should always rely only on a doctor to diagnose any symptoms you may be experiencing.